programs and supports that we are able to offer you. So please continue submitting your questions on Q&A, and over to you, Tracy.
Good evening, Flavia. Good evening, everyone else. Thank you for having me this evening. Thank you, Daisy. Okay, we can actually just start with the first slide. So when you are diagnosed with CKD, your social, financial, and health situation may experience a period of change and adjustment, especially as you move through this chosen treatment and onto kidney transplant. Part of the social work role is to assist patients and families in navigating these changes. Wherever you are in your CKD journey, we will always have a social worker available to you. In addition to providing support in the hospital, you may also choose to access programs and support outside of the hospital. And the hospital social workers hope to help you find appropriate resources and point you in the best direction. So basically, your renal social worker is just an additional support who is available to you. We understand that every individual is unique in their experience, in their symptoms, and their chosen path for treatment and their life circumstances. We also recognize that learning of a diagnosis has the potential to impact everyone differently. We know our patients are diagnosed, some patients are diagnosed earlier and have time to process their diagnosis. Or perhaps they have family members with CKD and are more familiar with what it means. And we are aware that some of our patients experience a diagnosis and treatment quite suddenly. Social workers are consulted on a very diverse range of topics, and in an attempt to provide the most important information in just this short amount of time that we have this evening, I'll just focus on a few of the main themes that you might discuss with your renal social worker while you are adjusting. Next slide, please, Daisy. Okay, so like I mentioned, social workers may have a variety of things to discuss with patients, but I've just chosen to focus on a few key items that seem to be common for all of our patients, really. And these are typically some of the things that your social worker will address with you. If you haven't met your social worker yet, it's easy to do so by asking your nurse or your physician or nephrologist or transplant surgeon for contact information or a referral to the social worker. Each person who is in our renal program has a designated social worker, including the DNPC clinics. So Daisy, I would like to just pose the first polling question at this point, please. And the first question being, have you connected with your renal social worker before today? So I'm not sure if the poll comes up before I move on. Thank you. Okay, wonderful. Is everybody's finished then? Thank you. Okay, so moving on to the next slide, Daisy. Okay, so medication coverage. If you are diagnosed with CKD, you will be taking medication. So long-term establishing coverage is a good plan. There are two ways to go with medication coverage. If you're employed, you generally might have employer health benefits, or perhaps your spouse or common law partner is employed and has employer health benefits that cover you. And I'm aware that some insurance policies might also offer private plans. The social workers in the hospital are mostly knowledgeable about the government-sponsored policies. If you are diagnosed with CKD and you have employer health benefits, now would be a really good time to get your booklet from work or from HR and go through that and become familiar with your medication coverage. And often they will have amendments for short-term disability and long-term disability, those sorts of benefits as well. So for the government-sponsored policies, there is one policy that you would still pay premiums for, and that would be the Alberta Blue Cross non-group. The non-insured health benefits are generally for people who have treaty status, and they get coverage for medication and other health benefits that way. For somebody who is not employed and they're not part of the groups below, as for example, a senior or on AISH or receiving income support, you would register or enroll in Alberta Blue Cross non-group. They do charge premiums. It is a government-sponsored policy, though we find it suitable for most of our patients. And the premiums are lower, and they don't take into consideration pre-existing conditions or limit your coverage by having yearly or lifetime maximums. The Alberta Blue Cross for seniors is a policy that's provided to people in Alberta over the age of 65. I believe other provinces would have something similar. And the AISH health benefits are would include medication coverage for people who are receiving the assured income for the severely handicapped. The Alberta adult health benefits is a benefit based on criteria. So it has an income criteria, and for lower incomes Albertans. Any questions that you might have about medication coverage and what would be the appropriate policy for you as far as the government-sponsored policies, it would be a great idea to connect with your social worker and just review your circumstances and get a little guidance from that person. Okay, next slide, please, Daisy. Okay, so the next thing I'd like to discuss is income replacement and disability benefits. Sometimes you may experience having CKD diagnosis may impact your income and your ability to work. So if you are presently employed, and there may be a time where you might have to access employer health benefits if you have those through work. Especially if you're starting dialysis or kidney transplant, there may be a period. So again, it would be a really good to find out about your benefits through work and find out what's available to you in case that were to happen. Your employer health benefits are different for every policy. So your social worker wouldn't know too much about it, but they might be able to have a discussion and provide a little guidance for you if you want to review your situation with them. The other programs that are available for income replacement are federal and provincial programs. There is employment insurance sickness benefits. So if you're currently working and you have to take a break from work because of your medical condition, you are allowed to apply to EI, and you can potentially get up to 15 weeks if you meet the contribution criteria, meaning that you've worked enough hours and paid into the program. And you'll also require a medical certificate from a physician to support that claim. Some employer health benefits don't have short-term disability benefits. They go straight to a long-term disability benefit plan, but there's a gap in between. So some employers require their employees to access the EI sickness benefits to bridge them to long-term disability benefits if the long-term disability benefits are needed. Another program that is available for people who are not able to work because of their medical condition is a federal program, and that's run through Canada Pension Plan. And it is the branch of that is the disability benefits. Again, you can apply to that program, but you must meet the contribution criteria and then the medical criteria. If you would like to learn more about if that would be an option for you, I would encourage you to discuss it with your social worker. And always, these programs are available online if you want to have a quick look at it yourself. After that, in Alberta, there's the assured income for the severely handicapped, in other words, AISH. Again, that's based on the ability, having the inability to work due to a medical condition, and the criteria that you would need to meet is a financial criteria for that one. So your income, your partner's income would be assessed if you have a partner, assets, etc. And then the medical criteria would need to be met to get those benefits. And then lastly, for people who are not able to access those programs and are of a lower income, but not able to work due to a medical condition, there is the Barriers to Full Employment program, which is part of the Alberta Supports Income Supports program. Again, you could be supported with a medical letter from your nephrologist or your family doctor to apply for that program. And please consult your social worker. Thank you, Daisy. Next slide. Okay, income tax time. When I see people for the first time coming to my clinic, not everyone is aware of the disability tax credit. And we like to get that for everyone who is on dialysis. There are other medical conditions that qualify for a disability tax credit. However, a medical condition related to CKD, it would be the actual dialysis therapy that is the qualifying condition or treatment. So if you are starting dialysis or if you have already started dialysis, please connect with your social worker, because you may be able to receive some financial benefit through your income taxes for being on dialysis. Another good resource that I like to share with people for their taxes is the Kidney Foundation has a link on their website for tax tips. Every year I look forward to them in updating this information. What I see on their tax tips is the Kidney Foundation basically pulls everything off of Canada Revenue Agency's website that could be beneficial or be of significance for somebody with kidney disease. So I would encourage you to look on that, especially if you're traveling for medical appointments and you're able to claim your gas mileage, meals, accommodation, depending on how far you're traveling. For example, for you to claim your gas mileage, if you're traveling more than one way, 40 kilometers one way, then you may claim the gas mileage. If you're going for a medical appointment that's not available where you live, or for hemodialysis. And if you're traveling over 80 kilometers one way, then you can also claim your gas mileage, meals, and accommodation. Plus, there is more information on there, so I would encourage you to have a look at it. Next slide, please, Daisy. And I wanted to include transportation for dialysis because we do have a lot of patients on dialysis in our program. Locally, we have DATS that's run through the city of Edmonton, and people don't need to necessarily have a mobility impairment to qualify. The fact that they're on dialysis, we can get them qualified for that service. DATS is, you've probably seen them driving around Edmonton if you live in Edmonton, for people with mobility issues, but they do consider hemodialysis to be a treatment that, you know, should be supported. In outlying communities, there might be mobility buses. Often people I see from all over Northern Alberta, Northwest Territories, etc. And I'm often looking up in their local community if there is any disability buses or mobility buses, looking for resources like family and community supports. Often community groups do have volunteer driving services, that sort of thing. And then, of course, you can drive yourself, or family members are often driving. And one new program I wanted to mention in Edmonton that Alberta Health Services has recently started promoting is Drive Happiness. I've worked with them a few times now, and you do register and you pay a flat fee, but it's very affordable, and it's for people who are, you know, needing to attend medical appointments or dialysis treatments, anything. So again, all of those resources are available online, and I would encourage you to see your social worker too. All right. A change in health status or any other concern, or trying to cope with your health and other personal issues at the same time can sometimes be challenging. After all, we're not provided with guidebooks on how to manage our evolving lives and situations. Most of our patients will be followed by outpatient clinics, meaning that you're not admitted to the hospital and you come to see us on a regular basis, like you might go for a checkup with your doctor or other specialists. We don't have access to mental health supports on our outpatient units. So often in consultation with your social worker, you can determine, you know, if a bit of support from your social worker is enough for you, or if you should consider a referral for mental health support in the community for ongoing support and follow-up. So I've just provided a few examples of what's available. We can make a referral to Alberta Health Services for mental health support at no cost. And then we are quite familiar with community agencies in and around Edmonton. And again, we're often looking for mental health supports in more rural type settings. The Kidney Foundation of Canada, on their website, you can find information on peer support and their online support groups, which is wonderful. And if you have employer health benefits, or if you don't mind paying, you can also seek out yourself private psychological services. And then it's important that we don't forget the family members. Often I meet families who family members who are providing caregiving to their loved one who is diagnosed with CKD. And the Caregivers Association is a very good resource to connect with. And I was just on their website recently, and they have a lot going on. I know a lot is virtual right now, but they're very organized and they've got support all through Alberta. And lastly, as with anything in life, sometimes the key to success is organization. And if I could offer any tips for a patient and the family members of a person who is diagnosed with CKD, in order to help them feel like they have some control over their diagnosis and whatever might follow, I would say to be organized and proactive. For example, when you're going to your appointments, prepare yourself so that you can get the most out of them. Write down your questions that you might have for your nephrologist or nurse. If you have a partner or a family member with you, it can be helpful to take notes. 4 eyes and ears are better than 2. The world is a little different these days, so check with your particular clinic before going, but generally a support person has always been welcome at the clinic appointments in all areas of the program. And please let us know if you need support, because adjusting to change can be hard sometimes. And I just wanted to tell you just a little bit about your social worker, just so you know. Sometimes we have very intimate conversations with our patients and families, and this is the person that you're sharing that information with. So social workers are trained professionals, and we are governed by the Alberta College of Social Workers and the Canadian Association of Social Workers. You can think of us as your resource guide. We might not know everything, and if we don't, we can certainly try and find out for you. Your social worker sees you as an individual with unique needs and circumstances, and sometimes it is difficult to know where to start. We're guided by ethics and values such as dignity, self-determination, and consent. We acknowledge you, the patient, as a member of your own team, and we will support and include you in your efforts to best care for yourself. And I don't know, Daisy, if we have time for the second polling question or if we need to finish there.
Hi, Tracy.
Hi there.
We will quickly launch the poll and then segue into the next section.
Perfect. Thank you so much.
And so 10 more seconds for everyone to answer. And so interestingly enough, I noticed the numbers actually matched for both the first and second poll. And so thank you so much for participating, everyone, in Tracy's polls. So now we will segue into the next slide. And so I am the kidney care manager here at the Kidney Foundation's Northern Alberta and the Territories branch. And so I will quickly go over some resources and support that we provide here at the Kidney Foundation. And so to begin, here we have our Kidney One-on-One Peer Support Program. And so this is a patient-driven peer support program. However, I simply want to highlight that it is more than just peer support. These are individuals that have direct ties to kidney disease. So it could be individuals that are on any modality of dialysis. We have living donors, caregivers, family members. We're a community here. And so we are here to connect with others that are just looking for someone to talk to. Next slide, please. And so next, this is a brief overview of our short-term financial assistance program, which we call STFA for short. And so you'll see the different icons that all provide examples as to how we have stepped in to support patients, whether they be dialysis patients or post-transplant patients. We have been able to support individuals so that they can access dental work. We've assisted with patients having food security, so that could be through the assistance of a grocery card or even weekend food baskets delivered straight to patients' homes. Other areas where we've been able to step in and support is through paying for medication, gas cards also, which are quite big for individuals, especially individuals traveling from out of town. So if they live in a rural community and need to travel to a city for dialysis, we have been there to support with gas cards. Some other examples also are for medical equipment, ambulance rides, or any sort of emergency living, whether that be us stepping in and paying for rent or us helping out with utility bills, you name it. We're very flexible in the areas that we support. Ultimately, this STFA program is here to support patients so that they don't have to worry so much about the financial burdens or hurdles that they go through while on their kidney journey. Next slide, please. And then lastly, this is just a brief overview of some other resources that the Kidney Foundation provides. We have our Kidney Community Kitchen, so if you're interested in learning about renal-friendly diets, you can visit that on kidneycommunitykitchen.ca. We also have our HUG program, which is the Home Hemodialysis Utility Grant. And so this is meant to offset both the electrical and water costs for individuals that are performing home hemodialysis. Next, you will see an individual here with a suitcase. And so despite us being amidst the pandemic and there being travel restrictions, we can help with assisting you figure out tips and insurance info for when it is safe to travel. We want you to live your best life. And if traveling is something that you enjoy, we're here to support you so that you can travel as best as possible. And then in the bottom right-hand corner, you will see our LODER program, which stands for Living Organ Donor Expense Reimbursement Program. So this is a program meant to help offset any financial costs that living donors experience throughout their testing journey. And so we don't want finances to be a barrier for these living organ donors. And ultimately, if you have any questions, I'll post my email here at the end so that you can reach out and we can chat further more about any of our programs. Thank you so much. I'll hand it over to Flavia.
Thank you, Tracy. Thank you, Daisy. And again, believe me, we're conscious of the time and we will have a hard stop at 8:30, but